Welcome back. Today we are going to talk about an issue that many people are unaware of. That is, cloves are long can be dangerous when consumed with certain foods and medications. Cloves, which are rich in antioxidants, are even more powerful than blueberries and have anti-inflammatory properties that surpass turmeric. According to research, cloves can reduce blood sugar levels by nearly 27%, and in some tests, they exhibit a stronger effect against certain infections compared to standard medications. However, here is where the danger lies. The very compounds that make clove beneficial can also cause harm when combined with specific medications and foods. The powerful compound eugenol constitutes about 80 to 90% of clove oil. Eugenol is responsible for the aroma and benefits of cloves, but it inhibits liver enzymes that process medications inside the body. These enzymes are responsible for metabolizing more than 75% of prescription drugs in the body. When eugenol blocks these enzymes, the medication's effect can either overly increase or completely diminish. Spices do not come with pharmaceutical like warning labels, which leads many people to think natural substances are safe. However, in reality, incorrect consumption can be dangerous. Today, we will discuss 7 foods and medications that should never be paired with cloves. Let's get started. Number 1, blood thinning medications. Research shows that combining cloves and blood thinning medications can be extremely dangerous. For instance, a patient who was prescribed warfarin following a heart attack experienced normal blood levels initially. However, during vacation, consuming meals rich in cloves disrupted everything. Within just 2 weeks, their INR climbed from 2.5 to 7.8, and even a minor injury resulted in uncontrollable bleeding. The primary cause of this incident was the use of cloves alongside medications. Eugenol in cloves prevent platelets from sticking together, naturally thinning the blood and thus inhibiting clot formation. Now imagine someone taking warfarin, clopidogrel, or aspirin while also consuming cloves. The combination excessively thins the blood. The result is that a small injury can lead to uncontrollable bleeding. This concern is not limited to clove capsules or supplements. Even a small amount of cloves added a daily meal can make a difference. The European Medicines Agency states in its report that individuals who consumed cloves alongside blood thinning medications experience severe bleeding incidents such as stomach bleeding, brain hemorrhages, and uncontrolled bleeding during surgeries. Similarly, the American Journal of Health System Pharmacy includes cloves among herbs and plants that excessively enhance the effect of drugs such as warfarin. The most unfortunate part is that doctors are often unaware of this interaction since patients generally don't disclose about their daily diet and spice usage. Therefore, if you are taking any blood thinning medication, limit your use of cloves to mild amounts for flavor. Avoid clove tea, coffee, extracts, supplements, or essential clove oils entirely. Number 2, medication metabolized by liver. At Johns Hopkins Hospital, there was a patient taking medications for cholesterol and anxiety. They noticed the effect of the medications were sometimes excessive and other times insufficient. Upon examination, it was discovered that the patient was consuming clove extract daily. This all occurred due to a system within the liver called cytochrome P450. This system metabolizes 75% of medications to either produce effects or remove them from the body. According to research from Saudi Pharmaceutical Sciences, eugenol inhibits these enzymes. When these enzymes are inhibited, medications can accumulate in the body, increasing their concentration and potentially becoming toxic. The greatest risk lies with medications used daily, such as statins for cholesterol, SSRIs for depression, blood pressure medications, and medications for treating anxiety. For example, if someone takes atorvastatin alongside clove, the medication might accumulate excessively in the body and harm the muscles and liver. Similarly, if someone uses sertraline with clove, It may cause the medication's effect to reach toxic levels. Some people experience effects with small amounts of clove, while others may remain unaffected even with higher quantities. This makes it difficult to predict who may experience harm beforehand. This is why it is strongly advised to inform your doctor if you are using any spices, herbal medicines, or natural remedies so that they can properly adjust your medication dosage. Number three, medications for diabetes. A true story proves that cloves can pose problems for patients with diabetes. An individual whose type 2 diabetes was well controlled with metformin and insulin started drinking clove tea twice a day. Within just a few days, they experienced hypoglycemia or a dangerously low blood sugar levels. What they believe would benefit their health instead caused excessive drops in their blood sugar, putting their life at risk. Thus, if you are using medications for diabetes or other long-term illnesses, exercise caution when consuming clove. The blood sugar lowering effect of clove have been scientifically proven. According to research, clove extract, which is rich in polyphenols, reduced blood sugar levels by 21.5% after meals in healthy individuals and by 27.2% in people with prediabetes. There are three mechanisms behind this. First, it slows the absorption of carbohydrates in the intestine. Second, it slows the release of glucose from the liver. And third, it increases the muscle's ability to use glucose. According to the Journal of Ethnopharmacology, clove extract inhibits up to 40% of the glucose release process from the liver, similar to what metformin does. When combined, the two may lower blood sugar excessively and result in hypoglycemia. Number four, alcohol. In a clinical study, it was observed that people who consumed alcoholic beverages with added clove, like mulled wine and clove cocktails, experienced intense facial flushing, rapid heartbeat, and dangerous blood pressure drops. The reason for is that eugenol, which is found in clove, inhibits the liver's process of metabolizing alcohol. It suppresses the enzyme called aldehyde dehydrogenase, which is responsible for eliminating the toxic component of alcohol, acetaldehyde, from the body. When this enzyme is inhibited, acetaldehyde accumulates in the body, causing facial flushing, rapid breathing, increased heart rate, dizziness, and headaches. Over time, this combination could lead to inflammation and damage to the liver. Individuals with liver conditions or those taking medication harmful to the liver should exercise caution when using clove and alcohol together, as it presents a significant risk. Number five, iron supplement. According to experts, excessive use of clove can inhibit the absorption of iron in the body. Due to the tannins found in the clove, its polyphenols form complexes with iron that the body cannot absorb. Excessive tannin use can reduce iron absorption by 60 to 90% depending on the dose and timing of consumption. If someone drinks clove containing tea alongside iron-rich foods like spinach or iron tablets, the iron benefit is reduced by more than half. Therefore, if you are taking iron supplements or consuming iron-rich dishes, it is best to avoid consuming tea or foods containing clove within 1 or 2 hours after eating. This is particularly important for those being treated for iron deficiency. If you think that clove only interacts with medications, it is mistaken belief. Number 6, fiber and digestive supplements. According to a study, people on high fiber diets such as those involving beans, whole grains, or vegetables who simultaneously consumed clove experienced excessive gas, bloating, and digestive issues. Although typically fibers help alleviate these problems, detailed analysis revealed this outcome was caused by eugenol in clove, a powerful antimicrobial compound. As a result, in addition to harmful bacteria, it also kills beneficial gut bacteria that help digest fiber into short-chain fatty acids, essential for gut health. When these bacteria are reduced, fiber digestion is impaired, leading to bloating and heavy stomach. It may also affect individuals with irritable bowel syndrome and inflammatory bowel disease. When the microbiome is disrupted, medications might not work effectively. Therefore, doctor advised that if you consume high fiber meals, Limit clove usage and wait 1 to 3 hours after eating to reduce adverse effects. Number 7. Foods with milk and rich in calcium. Regularly drinking tea mixed with milk or consuming foods rich in calcium may cause issues related to calcium absorption and digestion. According to research, cloves does not directly reduce calcium absorption but slows down the process of calcium utilization because it affects enzymes and gut bacteria. The polyphenols found in clove bind to calcium and other minerals, causing a slower absorption in the body. This means that if you regularly drink tea with clove combined with milk, yogurt, or calcium supplements, it may reduce the benefits of calcium. This is especially concerning for individuals at risk of osteoporosis or those taking supplements for bone health. Therefore, it is better to consume clove at a separate time from dairy or calcium supplements. Alright, thanks for watching the video. Please subscribe to watch more. Have a nice day.